Hello and welcome to National American University's webinar series. And we're focusing today on our careers in healthcare. We thank you so much for joining us. My name is Nancy Reggio and I am Director of Marketing here at NAU. I'm so very pleased to have all of you join us. We do have a number of people still logging in here, so we are going to wait about 1 minute and then we'll be back on the line and get this presentation started. Thank you. Hello and welcome to NAU's Allied Health webinar series. Today we join Dr. Smith, Associate Dean of the Online Allied Health Programs at National American University, and faculty member Robert Kane, and they are here to talk about healthcare opportunities. So we offer many degree and certificate programs here at NAU, and I encourage you to visit us online for more information at www.national.edu. A few things I want to share before we kick off the webinar. First, your lines are on mute, and we do that to reduce background noise. We do want your participation, so I'm going to ask that you use the question and answer piece. It's a chat on the bottom of your screen, and we'll revisit those during the Q&A period at the end of the webinar. The second thing is we are recording the webinar, so you'll get the full audio and video from today's presentation. And with that, I turn it over to Dr. Smith.
Hello, hello, and I'm so very happy to be here and speak to you about the opportunities in healthcare management. So, why work in healthcare? That's the question, that's the age-old question. Because healthcare is one of the fastest growing job sectors in the U.S. workforce, you can be sure that there are opportunities that will be available now and later in the future. Healthcare offers really great benefits and salaries. There are lots of choices for direct and indirect patient care. And when you work on a team that helps others, it gives you so much of a fulfillment, and you really do make a difference in those patients' lives. Did you know that healthcare skills are portable? Which means that when you combine those people and those sciences in the business, you're able to transfer the knowledge that you've learned to any area that you're working in. Healthcare allows for, number one, job satisfaction, and number two, job security. Why do we say healthcare management is important? Well, the obvious word is care. It's your job to make sure that doctors and nurses give quality care. It's also your job to manage operations and budgets and policies to ensure that the organization is doing what they're supposed to be doing for the particular patient. Hey, a career, healthcare management is a career that lets you make a difference in people's lives. I was introduced to healthcare management early on in my career when I actually learned all about the managerial aspects of healthcare, so much so that I decided to start my own consulting firm with that training that I received in healthcare management and that experience that came along with it. In starting that consulting firm, one of my prides was being able to help federally qualified healthcare centers be able to obtain electronic health records. And in order to do so, I had to go in and, speak with everyone, and for us to all understand why it's important because of the patients that are being serviced. So I just really want you all to understand that healthcare management is very important in our society today, because people get sick, and people who want to maintain their well-being and their wellness look to us to make sure that everything is done appropriately. So why should you pursue a Bachelor of Science in Healthcare Management? Well, many students choose to pursue these degrees because you'll gain those business skills required for management roles. There are so many different types of areas that you can go into, and with this training, it will really help you to propel in those areas. It also, it's a good choice for those who want to go in management and leadership and working in a business capacity in healthcare. Like myself, I wasn't the one that would actually, touch patients, because I think there's a special type of person that would love to give direct care to patients. My mom was a nurse for over 20 years. So I totally understand the devotion and the characteristics that that person needs. And I looked at it from a different standpoint, that I'm able to help people's lives by the information that I'm receiving and the knowledge that I'm receiving as I was going through getting that healthcare management education. So much so that with that education, it has allowed me to also open the door for advanced leadership roles, such as being a consultant. So why pursue an online degree at NAU? Our online Bachelor of Science Healthcare Management degree helps you to become effective managers and leaders within the healthcare industry. And in doing so, you're really setting the standard and setting the bar for what happens with healthcare in America today. With our program, we have required core courses, support core courses, and also 2 specialized options for you to obtain your degree. With those options, the first option is option 1 for students who may transfer in either a healthcare diploma or an associate degree, and you're seeking promotion to a supervisory or a management position in your field. And we call that the 2+2 program, because you've already transferred in what's equivalent to about 2 years worth of coursework. So all you have left to do to finish the 4-year degree is 2 additional years. And for option 2, that's more of the traditional students seeking that business-related position in healthcare with no previous diplomas or degrees. We have the performance-based curriculum, and I'll go over some of those key courses, such as Intro to U.S. Healthcare Delivery, because right now, things are changing in healthcare, and it's a constant change in healthcare. And to be able to understand how healthcare is delivered in the United States is very important, along with planning and evaluation to ensure that those strategic plans, along with those short-term plans, are made. You got to have policy, ethics, and law. Under healthcare policy and ethics, you understand what goes into making those key decisions in healthcare. And of course, with the law that provides the background, but there's also a course in regulatory environment in healthcare, because when you're looking at the policies and looking at the ethical perspectives, and then you're looking at what it says in law, you also have to look at the regulations, the accreditors, the agencies like the Department of Health and Human Services, the Centers for Medicare and Medicaid Services, the Centers for Disease Control, and so many more. So understanding how they all fit into what you're going to be doing in healthcare really makes the difference and sets you apart from others in the healthcare industry by understanding this information. And last but not least, we have financial management and management and supervision. Under financial management, you learn how to budget, you learn how to manage projects and things like that that involve costs. You learn the debt ratios. You understand more about what it takes for a healthcare facility to be able to thrive, whether it be for-profit or not-for-profit, public or private. And under healthcare management and supervision, people. You have to understand how to work best with people, how to lead people, how to manage people, how to supervise people. And so these are the key courses, and there's some other required support core courses that you would take in order to get to these courses. But some may have already been transferred in if you were under option 1. Students in the program learn fundamentals of key healthcare operations, explore industry issues, and also become competent in healthcare financing, which is one of those major pieces. And graduates will demonstrate the professional and ethical management of others, understand those financial management principles and be able to put them into use, examine those legal principles, and also be equipped to examine the efficiency and quality of patient care delivery and support services. Because one of the courses from the previous slide was about quality improvement in healthcare, because it's not always about trying to figure out what's wrong. It's always about trying to make whatever you have better. And on that note, I will turn it over to Mr. Kane so that he can provide more information on exactly what is it that healthcare managers do.
Dr. Smith, thank you so much for the introduction. I really do appreciate it. It is a great pleasure to be able to speak with you today about the healthcare management programs here at NAU, some of the key responsibilities of healthcare managers and administrators, and some of my experiences as a healthcare manager and administrator. I have worked in healthcare and healthcare administration for many years. And one of the great things about the career is really the variety that exists in responsibilities and the many opportunities that present as a result of having the required and desired education. I mentioned variety. This is certainly the case in healthcare. Some, certainly not all, of the responsibilities include things like developing plans and establishing goals for departments or various business units, recruiting, onboarding, and training staff, direct supervision of staff. As healthcare administrators, we work to prepare budgets and to monitor those budgets to ensure the financial health of the organization. And one of our key responsibilities is, as Dr. Smith mentioned, really working to improve efficiency and play a key role in monitoring quality and implementing quality controls. Continuous quality improvement is an important part of the job, regardless of the setting that we work in. So on to the next slide. Some additional responsibilities involve really ensuring compliance with regulatory and accreditation standards and participating in audits, surveys, and communications with these important stakeholders. I mentioned communication as this is vitally important. As healthcare managers, we need to be able to effectively communicate with teams and a host of individuals, including clinical staff, administrative staff, and even people outside or external to that organization. So we have listed here on the next slide some pretty important competencies as a student here at NAU, and we will help you to develop and fine-tune those competencies throughout your program. These include things like communication skills, so both written and oral communication skills, planning and organizing skills, analytical and reasoning skills, the ability to gather information and make informed decisions, team building skills, conflict resolution skills. Again, these are competencies that you will develop and really hone as you work your way through our program. The next slide kind of talks a little bit about some of those opportunities, and they really are endless in healthcare management. You might consider working in the home health industry or the insurance industry, in practice management, hospital administration, public health, long-term care, quality improvement, patient finance, and more. One of the great things about healthcare administration is that there are many opportunities, and it's not just us saying that. It is supported by fact. On our next slide, you'll see here that the Bureau of Labor Statistics really predict that between now and 2026, there's expected to be about a 20% growth in health manager positions, and that is higher than all other positions. As you can see, the earning potential is fantastic. The number of jobs clearly demonstrates that choosing a career in healthcare is a wise decision. But perhaps what is most important, and at least in my experience, is that in this industry, you have a real opportunity to make a difference in the lives of others. So how do we get there? Well, you'll see here that, and I do want to just quickly mention, experience is important, but at the end of the day, that experience is quite frankly not going to get us probably to where we want to be. That alone is just not enough. We need a quality education, and that is what healthcare organizations are telling us that they are looking for. We can do that through an associate's degree, a bachelor's degree, even a master's degree. It is worth mentioning that while there are many programs for those interested in healthcare management and administration, I believe our program is unique. I believe that, and I've seen over the years that I've been teaching here, that we provide a supportive, encouraging, and caring environment where you can really strive and with our support, be successful, learn the material to be able to use that knowledge in the real world. Mine has been a wonderful career. I wish the same for you. I'm now going to turn it back to Dr. Smith, who can share a little more about the program and how you can join our NAU family and learn more about our various program offerings. Dr. Smith, I'll turn it back over to you.
Thank you so much, Mr. Kane. And I really do appreciate you really giving information to the participants that really hones in on exactly what healthcare management is all about and where you can work and the salaries that you can make. There are many different benefits of attending National American University, particularly for our healthcare management program. Why NAU? Number one, it's 100% online. There are 2 courses at the end. You can choose between the 2 courses. One could be a practicum where you take it virtually online, or the other could be action research where you go out into the field and actually do an internship. We have monthly starts, so you can jump in right now while the iron is hot. We have affordable tuition, and as Mr. Kane said, and he's been a tremendous asset to this program with the years of experience that he brings and his level of concern and compassion for the students, really in helping them on their way to meet those competencies that he spoke about earlier. We have that caring and compassionate faculty, and I believe that that's one of our greatest assets is that we have people who are really here to help you to understand, number one, what you're doing, what it's all about, and then to push you on to graduation so that you can really thrive in the career that you've chosen. And I wanted to just give you a little bit more information on how you can contact us. For more information, you can email healthinformation@national.edu. You can also visit our healthcare management program website by visiting www.national.edu and clicking through the programs. There's also a link here. And we also have a phone number to admissions, which is 855-448-2318. And now I'll turn it back over to Nancy to see if there are any additional questions.
Oh, thank you so much, Dr. Smith and Mr. Kane. This was really interesting. We do have quite a few questions, so I want to get started on those. But also for everyone listening, if you do have a question, please go ahead and send it over to us. We want to address all of these for you. So let me start with one. A question for either one of you. I have no job-related experience. After finishing a bachelor's degree, what can I do?
What can't you do? There are because health, let's just go back to the slide that had 406,000 jobs. There are so many different opportunities. Particularly, you can start out in an entry-level position within healthcare. Even being a middle manager can be considered an entry-level position because you have a bachelor's degree in healthcare management. That automatically gains you, quote unquote, some years of experience. Todd, would you be able to add more?
Yeah, absolutely. It's a great question, actually, and probably one of the most frequent questions I hear from students. They say, I'm working on this degree, but what can I do when I'm finished? And I have a couple of things to just for you to think about. Number one, employers are looking for competency. And competency certainly can and does come from experience. But competency also comes from the education. So as you move through the courses and you achieve various learning outcomes, those then become competencies, and you've achieved those because you've passed the course. So one of the things that I always suggest students do is very early on, let's start having a conversation about how do we frame your resume and your current experience using the competencies that you achieve here in school to what your future career, what your future business card says. So as Dr. Smith said, there are a lot of entry-level positions. You can work in the home health industry, in the staffing industry. You can be a unit clerk. You can be an office manager, assistant office manager. There are going to be lots of opportunities to get that career started. But I also suggest we start having that conversation very early on in your career so that when you're walking across the stage and gathering your diploma, you're not looking back at Dr. Smith and saying, now what? We really want to help you to get there as you go through. And you may not have real world experience in healthcare, but I can almost guarantee you that much of the experience you do have can map back to a career in healthcare. That, coupled with the competencies that you will achieve as you move through the courses and through the program, I think will set you up really nicely to transition into and get started with a robust and exciting career in healthcare management.
And can I just add to that really quickly? I got my first, I'll call it my first real career path, 40-hour-a-week job with salary and benefits in healthcare, literally right out of school, because I was shown to be competent during my internship at that facility. So I showed them what I knew basically from my training in school and was able to get a job that they created based on competency. So as Mr. Kane said, learn all you can, master those competencies, and the rest will come.
Fantastic. Mr. Kane, I've got a couple of questions that have come through specifically for you, so let me throw one out here. What is one piece of advice you'd give to someone entering the program?
I think the number one piece of advice I would give is to, as Dr. Smith said, really learn the material, demonstrate that you're meeting the competencies. And as I said, starting from day one, class one, start thinking of yourself as a healthcare professional, start thinking of yourself as a healthcare administrator, and building out the resources, resumes, cover letters, looking at various professional associations, kind of fine-tuning where you want to go. I think the best advice I can give you is enter the program, viewing yourself as a healthcare administrator, and taking advantage of all of the resources that we have here at the school to help you get there.
Fantastic. Anything you wanted to add, Dr. Smith, to that?
One thing would be also, as you learn what you really like to do in healthcare, whether it is on the budgeting side, whether it's on the regulatory side, try to hone in and grow off of those niches, those things that you really like to do, that you can carve yourself out and say, hey, I really want to become an expert in this. Pull all of that information forward and go and sit up under someone that does what you think you want to do for the rest of your career. Sometimes that can be very helpful. I thought I wanted to be an occupational therapist, and then once I sat under under healthcare managers and healthcare management, I understood that that's my calling, and I really, really liked to understand that information. And now, because of the diverse opportunities in healthcare management, I'm able to teach that information, and I'm able to be a dean over a program that teaches others that information. So, hey, so much to learn, so much to do, and so much to be rewarded with.
Ah, fantastic. So there's a kind of a two-part question. One of our attendees is asking, do you need to have certain certifications? And then the second part really is, if you do, then how do they do that? And they'd like to know how to get more experience in things like Excel and Microsoft programs as well.
Yeah,
if those are things required.
Yeah, fantastic questions. I saw those questions. With regard to the Excel and Microsoft Word, one of the great things about working in an online program like this is you will really enhance those skills as you work your way through the program. You're going to be doing work that may require the use of Excel or may require you to write a paper or use Microsoft Word. We provide resources to help you get there. Your instructors can help you get there. There are a lot of resources. The short answer to that is, well, down the road when you're working in healthcare administration, there will be an expectation that you have you're proficient with things like Microsoft Word and Microsoft Excel and PowerPoint and those kinds of things. And you kind of learn that. It's a little bit of a bonus you kind of learn that as you work through the curriculum. With regard to the certifications, here's what I would say. There may be additional certifications that you might find yourself interested in, depending on the direction that you choose to go. Step one is to really get the degree, to get started, to start working on the program, start working through the courses. Now, for example, let's say that down the road you decide that you're really interested in practice management, or you're really interested in the long-term care industry. As you kind of fine-tune that direction, we talked earlier about there's so many opportunities in healthcare. Don't let that overwhelm you. What I found is that students come into this with an idea of, oh, I want to be a long-term care administrator, or, oh, I want to work in home health. And many times they change their mind as they work through the program because they meet with Dr. Smith, or they meet with myself or other faculty who have real world experience. And so they find a new passion. When you've identified a specific direction that you want to go, a specific sector of healthcare, there may be certifications that might be needed, or probably more likely would enhance your ability to find a job in that particular sector. But those are all things that we can explore kind of as you work your way through the program. I hope that answers your question. Dr. Smith, did you have anything you wanted to add? I just kind of jumped in on that one.
Oh, no, that's perfect. That is absolutely perfect. I concur. I concur, because I have a lot of niche areas where I said, I really, really like this area. So I'm going to learn even more about it. And then getting a certification in it, it bolsters your competencies even more.
I think a good example of that is, like RHIT or RHIA certifications. If you find out that you're really interested in health information management, those might be some things down the road that kind of enhance that if you decide to go down that path. But like I said, I think a lot of times students think one thing when they come in, and then they learn there are so many opportunities, or they find a new passion. And then there's plenty of time to look at joining professional associations and checking out those various certifications.
Absolutely.
Oh, thank you. There are a couple of questions about working with NAU success coaches, and if, how they might help finding internships. And I think they're also related to this other question, which I hope you can address those, but also a question being asked, and she's asking, when first looking for employment, what's a good place to start? I feel so overwhelmed looking at all the options. I already have my associate's degree and I'm working on my bachelor's, but I'm still not sure where to start. I've been a stay-at-home mom for the last 4 years, so I'm a little scared to get out there.
Well, let's start with don't be scared, because you are working through and obtaining that bachelor's degree. Right now you can start looking at different job descriptions to see if that's fitting into what you want to do. And we keep saying because it's what you want to do because of the diverse opportunities in healthcare management. So where do you start? You can start with your success coach. If you're in healthcare management, you can contact myself. Even when you're doing internships, and I know that was kind of weeded into one of the questions, you learn and understand more about different organizations that you may be willing to work for based on the skill set that you bring and what you want to enhance at that particular job site. And we have, professionals on our side of the house that really help you understand and kind of branch out into where am I going to start? Let's start with putting your, making sure your resume is crafted and up to speed, and you're including those key courses that you're taking, and you putting your resume out there. And then also looking at different job sites that are more specific to healthcare, or even filtering by healthcare settings. If you wanted to work, in a larger institution, if you wanted to work somewhere that's right in your metropolitan area, these are good places to start. But of course, you start with your resources, which is us.
Thank you so much. So for someone with a bachelor's degree, without any experience, they're having a hard time right now finding a job. Do you have any hints or tips on some additional things to be doing?
I think that ties kind of into the last question there. And I'd just like to add to what Dr. Smith said, that at the end of the day, this really all starts with a very good resume. It starts with a good resume that frames you, that makes you look, feel like a healthcare administrator in the sector of healthcare that you're most interested in working in. Just like medicine over the years has specialized, healthcare employment has really specialized also. And so the advice that I would give you if you wanted to work in long-term care administration would be very different advice than, say, if you wanted to work in home health or you wanted to work in hospital administration. So I think the first thing is kind of decide what sector of healthcare you want to be in, number one. Number two, work with faculty members, Dr. Smith, or other resources that we have here at the school to make sure that you have a killer resume. I've run healthcare employment firms my entire life, and I've interviewed personally about 10,000 people over the years. The companies that I've run have hired well over 1 million people over the years. And I can tell you that it starts with identifying a sector, building a resume that helps to craft you as that person in that sector. And that's kind of where I would suggest you really start. And again, Dr. Smith mentioned there are lots of folks here to help you do that. Faculty, Dr. Smith, success coaches, and other resources, so we can certainly point you in the right direction and help you get there.
Is there a good way to get current contact information for each of you?
Sure thing. If you want to put my, well, that email address, that works, that will come directly to me because I get copied on each of those as well. But I can also give you my number. It is 605-431-3563. Again, 605-431-3563.
And my email is rkane@national.edu. So feel free to reach out to me as well. If you don't mind, I did see Nancy Rubin's follow-up question there about, do all resumes need a cover letter?
Yeah.
I'd love to tackle that if you would allow me to.
Oh, please do.
So I hear this conversation all the time about, well, in this day and age with electronic resumes, do we need a cover letter or not? The answer is yes. It's more important actually than ever before. There's research that shows that hiring managers take about 6.8 seconds to decide if your resume is going to go in the stack to review later or immediately into the shredder. 6.8 seconds. I know for myself, I've hired so many people over the years and I've helped other people build careers that I can review a resume very, very quickly. So here's something to consider. If you have a cover letter, if you have a resume, set a timer on your phone and start reading. How far do you get in 6.8 seconds? So yes, the cover letter is incredibly, incredibly important. And one other just little sidebar conversation with regard to that cover letter. When you're using a cover letter, do not make the mistake of using what we call a canned cover letter, one that you've written, and then you just send out with every resume that you send out. Never a good strategy. Lots of opportunities for mistakes, but more importantly, the job ad, it tells you exactly what they want. They're not hiding anything from you. So starting with a blank Word doc and that job ad, to build a really compelling cover letter, ask yourself this question. If I read your cover letter and I've got 6.8 seconds to do it, is that cover letter going to map very specifically to the job ad that I placed? Something to think about, Ruben. I hope that's helpful.
Wonderful. And I do want to make sure everyone knows that the contact information for Mr. Kane and for Dr. Smith will be with this presentation. So we'll be sending it out to all the attendees, so you'll be able to reach everyone directly. So don't worry if you didn't jot everything down quick enough. One of the other questions that I received actually from an email was, if someone wants to get started in one of the NAU programs, what steps do they take to get going?
Well, one of the first steps is to contact our admissions department so that you can get all of the necessary paperwork required. And you can do that by calling 855-448-2318, or you can email me at healthinformation@national.edu, and I can make sure that someone from admissions and our enrollment counselors give you a call to set something up, just to make sure that we have, if you're in that 2+2, if you already have a degree, that we are getting those official transcripts and things like that. If you're going to be applying for any type of aid, financial aid, that information is filled out completely, and then get started once you're enrolled, get you started on when you actually want to start, because we start every month, and getting your course materials and things like that. So I know I've jumped all the way from admissions to you being in the program, but it's just as simple as that, as we have people on deck to help you right now.
And for a follow-up to that, for someone with an associate's in medical administration, does that allow them to transfer units or transfer credits to the NAU program or towards their bachelor's?
Absolutely. Absolutely. So that would be considered in that 2+2 program, where we transfer in a block of your programs up to 42.5 credits. And then you would take the other 2 years in those required support core and required core courses and be done with the program in about 2 years.
Fantastic. Wow. Well, I think we have time for one more question here. And really, there's an additional question related to the resume and cover letter piece. And I think that it's important. Perhaps we can chat about that. So if you have a job history that's not great, do you list it anyway, or do you focus on building a skills resume?
My answer is a little bit of both. First of all, resumes should go back 5 to 7 years. So one of the big mistakes I see is people go back, 10 years, 15 years on their resume with employment, and really that's A, not appropriate, and B, it's usually not applicable to who you want to be today. So if you worked at McDonald's 15 years ago flipping cheeseburgers, that's probably not something you would want to include on your resume. I do think there is a balance, so employers do want to know your work history, because work history can be, not always, but can be a predictor of future. That's one of the reasons even in healthcare, when we do budgeting, we look at the history, we look a little bit in the rear view mirror, and then we focus out the windshield. So I think it is about how you frame the resume. So you can really focus in those cases where you don't have the most favorable job history. You can kind of focus on your education. You can focus on your skills, so that the employment's not the first thing that people see and is not the thing that's most in front of them. And then I also just want to mention that one of the things about healthcare, people who come into healthcare, people who hire other people to work in healthcare, most of us really care about people. And we also recognize that we have an ability to change, that our past is not necessarily a reflection of our future. And I see that, and Dr. Smith sees that every day with students who come in where they've got maybe not the best academic history or maybe not the best employment history. But we recognize that, again, past is not always a reflection of who you're going to be in the future. So I think when you're interviewing with people, you want to make sure that you can explain your job history, because I would ask you questions about that, but also recognize that most of the people that you're going to be interviewing with, they work in healthcare for a reason. It's because they believe in second chances. They believe in giving people opportunity. And I think that if we build out a really good resume for you, and focus on the skills, the competencies from your education, and you are prepared to have meaningful conversations about your work history, focusing on the good things, not necessarily on the bad things, but also focusing on quality improvement. I mentioned it earlier, we talk a lot about quality improvement in healthcare. That starts with us. And so I hope tomorrow that I am better than I am today. And I hope that's the case every single day for the rest of the time that I walk on this planet. And I think that if you can convey that to people, that you are interested in improving and interested in growing and developing, and you build a resume that highlights all of the good stuff, I think you'll find it's less of an issue than you might believe it is today. Long answer, but I hope that provides you a little bit of relief.
Sounds perfect. So I do have another question here from Ruben, and I'm wondering if perhaps it would be important for him to reach out directly or through the success coach. Either way, looks like maybe this is something really particular, and I think that we could provide some additional assistance that way. Is there anything in general? The question is really just about how to continue to get more help with things like Excel and work on perhaps some interviewing techniques to help along the way. Dr.
Lots
Smith,
of
do you have any?
resources.
Oh,
Yeah, lots
sorry.
of resources out there online for things like that.
Yes.
We can provide you some resources and some tutorials on those things. I'm certainly not an Excel wizard, but I get better at it over time, the more I'm kind of forced to do it. So yeah, absolutely reach out to us and we can share some resources. I'd be happy to put some together for you.
Absolutely.
Wonderful. Wow.
And I've gone through those tutorials myself, so I understand that you just continue to learn more. I was like, I don't know how to do a pivot table. Well, let's just look online and find out how to do a pivot table. And sometimes it amazes me that the steps are so well thought out that I can literally teach it, just by learning based on those steps. So that information is readily available, and contact us and we'll get some information to you.
Fantastic. Well, I want to thank everyone for being part of this webinar. This was great. I love the level of interaction, so many great questions. And as always, Dr. Smith, you did a fabulous job. And as you did, Mr. Kane, really appreciated you being here with us as well. We will have another webinar coming up, so we will let everyone know when that is, and we'll be getting this recording out to all the attendees. Was there anything else that either one of you wanted to add?
I will let Dr. Smith have the last words. I just will say I wish you much success, whatever you choose to do. If we can help, we're here to help. And Dr. Smith, thank you very much for inviting me here today. I appreciate it.
Not a problem, and thank you for being able to share so much insight. And again, as healthcare management, just find your niche, understand what it is that you want to do, and those passions as you enter the program, those passions that you start to develop, just really for self-actualization and to get you where you want to be. And the time is now. The time is now. And I just thank you all for participating and listening to our words of wisdom to help propel you into a place where you're able to share words later in life as well. Thank you.
Thank you, everyone, and go have a great rest of the day.
Thank you, everyone.